Okay, so I did my presentation on Alzheimer's medications, and I just wanted to go over what Alzheimer's disease is. And it's a form of dementia that affects memory, thinking, and behavior. It is the most common form of dementia, which accounts for 60 to 80%, with a worsening prognosis over time. And the expected lifespan after diagnosis is 4 to 8 years, with mild, moderate, and severe stages. The best practice guidelines come from the Alzheimer's Disease Association, with them saying that the treatment of symptoms is how we approach it, with cholinesterase inhibitors, glutamate regulators, and combination therapy. For mild to moderate Alzheimer's disease, we start with donepezil, galantamine, and rivastigmine. And when it progresses to moderate to severe Alzheimer's disease, we keep using the donepezil and rivastigmine, and we add on memantine. For drugs that treat the symptoms, that is your cholinesterase inhibitors, which treat the symptoms related to memory, thinking, language, and judgment. And those are your donepezil, rivastigmine, and galantamine. The side effects of these medications are nausea, vomiting, loss of appetite, and increased bowel movements. With the glutamate regulators, they improve memory, attention, reason, language, and ability to perform simple tasks, and that is your memantine. The side effects of memantine is headache, constipation, confusion, and dizziness. The drugs that may change the disease progression is aducanumab. It's a new medication that's about a year and a half old, and it is an anti-amyloid antibody IV infusion that targets the beta amyloid plaques in the brain that we think is what is reducing the cognitive and functional decline in our early Alzheimer's patients. The side effects for this are headaches, falls, allergic reactions, and temporary swelling of the brain with spots of bleeding in or on the surface of the brain. And that is because it is an antibody infusion, which causes inflammation, which temporarily starts the destruction of the beta amyloid plaques, but that goes away after the IV antibody infusion is discontinued. With the pharmacodynamics and pharmacokinetics with the aducanumab is, like I said, it removes the beta amyloid plaques in the brain to increase cognitive function. With the cholinesterase inhibitors, it prevents the breakdown of acetylcholine in the brain, just like it does anywhere else in the body. And with the glutamate regulators, it blocks the toxic effects associated with excess glutamate and regulates glutamate activation in the brain. The effects on the body systems are about the same for all of the medications. They cause nausea, vomiting, loss of appetite. It can either cause constipation or increased bowel movements. They can cause temporary confusion and headaches and dizziness and falls because some of them can temporarily lower blood pressure right after it's taken. And then with the amyloid antibody infusion, it can cause the brain swelling and bleeding and vision changes. With the economic factors, we have about 5 million seniors that have Alzheimer's, and that was in 2020, and is projected to increase by 180% by 2050. And it's costing around $159 billion per year, and it is the sixth leading cause of death. And the picture also shows that the average survival after diagnosis is 4 to 8 years, and around 70% of Alzheimer's patients pass away in nursing homes because they have to have that extra care that most at-home caregivers are unable to give once they get to the severe stage of Alzheimer's disease. With the precautions for all of the medications, we want to make sure we have good care coordination between pharmacists and the care providers. We want to make sure that there aren't any drug interactions between the Alzheimer's medications and the medications that they may be on for blood pressure or diabetes. And we need to make sure that the caregivers understand that the medications need to be taken as directed and to not skip any doses or give an extra dose if one is missed. Keeping a medication list is very important for the caregivers. If the patient might have to go to the hospital or just with their regular primary care provider, it's good to keep that so we know what they're taking. And with the medication safety, we need to make sure we keep them in pill organizers so we don't give too much or forget to give medications. And having a good medication routine is good for the patient. And with the home safety, we want to make sure that we store hazardous items, whether it be the pills themselves, knives, firearms, anything that could possibly hurt the patient. We want to keep those in a locked cabinet. Keep a poison control number handy in case the patient consumes something that they aren't supposed to, and to keep good lighting in the home, as well as removing tripping hazards like extra furniture or throw rugs, because some of the medications can cause the dizziness and sometimes they won't pick their feet up like they are supposed to and they'll trip over small things like throw rugs. And we want to remove locks from the interior doors because with Alzheimer's patients, sometimes they can accidentally lock themselves in a bathroom or a bedroom and they don't know how to unlock the door and get themselves out. And with these medications, sometimes they can temporarily also increase the confusion when the medication is started. And these are my references, and thank you for watching my presentation.